Some common symptoms of anxiety disorders include physical symptoms, muscle tension, headaches, fatigue, rapid heartbeat, sweating, and trembling. Behavioral symptoms, avoidance of certain situations, difficulty concentrating, restlessness, and irritability. Cognitive symptoms, negative thoughts, unrealistic fears, and difficulty controlling worry. Emotional symptoms, feelings of dread, panic, or impending doom. Symptoms can also vary in severity and can range from mild to severe. Anxiety disorders can also occur with other mental health conditions such as depression, substance abuse, or eating disorder. It's important to note that everyone experiences anxiety in different ways, and a diagnosis should be made by a professional after a thorough evaluation. How do I know if my child has an anxiety disorder? Recognizing the signs and symptoms of an anxiety disorder in a child can be challenging, as children may not always be able to articulate their feelings or understand what they are experiencing. However, some common signs of anxiety in children include excessive and persistent worry or fear about everyday situations, such as school, social activities, or the future. Refusing to go to school or participate in social activities. Constant complaints of physical symptoms such as stomach aches or headaches. Difficulty concentrating or completing tasks. Difficulty sleeping. Constant complaints of fatigue. Irritability or restlessness. Avoidance of certain situations or activities. Excessive clinginess to parents or caregivers. It's important to note that it's normal for children to experience some level of anxiety, especially during times of transition or stress. However, if these symptoms are interfering with your child's daily life and causing significant distress, it may be an indication of an anxiety disorder. It's recommended to consult a healthcare professional such as a child psychiatrist or psychologist, who can make a proper diagnosis after a thorough evaluation. How are anxiety disorders diagnosed? Anxiety disorders are usually diagnosed by a mental health professional, such as a psychiatrist, psychologist, or clinical social worker, after a thorough evaluation. The evaluation typically includes a discussion of the individual's symptoms, medical and family history, and any other relevant information. The professional may use diagnostic tools such as standardized questionnaires, interviews, or rating scales to assess the symptoms and their severity. For children, the professional may also observe the child and speak with the parents, teachers, or other caregivers to get a better understanding of the child's symptoms and how they are impacting the child's daily life. The most common way to diagnose anxiety disorders is by using the Dian and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. It provides criteria for different types of anxiety disorders and other mental disorders. The professional will use these criteria to determine if the individual meets the criteria for a specific disorder. It's important to note that a proper diagnosis is essential for effective treatment, and only a professional can make a diagnosis after a thorough evaluation. Who can diagnose anxiety disorders? Anxiety disorders are typically diagnosed by mental health professionals such as psychiatrists, psychologists, clinical social workers, or licensed counselors. A psychiatrist is a medical doctor who specializes in the diagnosis and treatment of mental health conditions, including anxiety disorders. They can prescribe medication and may provide therapy or refer the patient to a therapist for additional treatment. A psychologist is a mental health professional who specializes in the study of the mind and behavior. They can provide therapy and may also administer psychological assessments to help diagnose an anxiety disorder. A clinical social worker is a mental health professional who has a master's degree in social work and is trained in providing therapy. They may also provide case management and support services and can work in hospitals, clinics, and private practice. A licensed counselor is a mental health professional who holds a master's degree in counseling or a related field and is trained in providing therapy. They may work in a variety of settings, including private practice, schools, and community agencies. It's important to note that each professional has their training, expertise, and approach, and that it's important to find the right professional that meets your needs. How are anxiety disorders treated? Anxiety disorders are usually treated with a combination of therapy and medication. The most common forms of therapy used to treat anxiety disorders include cognitive behavioral therapy, CBT, which helps individuals identify and change negative patterns of thinking and behavior, and exposure therapy, which helps individuals gradually confront and desensitize themselves to their fears. Medications commonly used to treat anxiety disorders include selective serotonin reuptake inhibitors, SSRIs, benzodiazepines, and beta blockers. It's important to note that treatment should always be tailored to the individual and that some people may require a combination of different treatments. How does medication treat anxiety disorders? Medication can help treat anxiety disorders by altering the levels of certain chemicals in the brain known as neurotransmitters. These chemicals play a role in regulating mood, and imbalances in their levels can contribute to the development of anxiety disorders. Selective serotonin reuptake inhibitors, SSRIs, are a class of antidepressant medication that increase the levels of the neurotransmitter serotonin in the brain. Serotonin is thought to play a role in regulating mood, and an imbalance in serotonin levels is thought to contribute to anxiety disorders. SSRIs are commonly used to treat anxiety disorders such as generalized anxiety disorder, panic disorder, and social anxiety disorder. Benzodiazepines are a class of medications that work by increasing the activity of the neurotransmitter GABA in the brain. GABA is an inhibitory neurotransmitter that helps to calm down the activity in the brain, making it useful in reducing anxiety symptoms. They are commonly used for short-term relief of anxiety symptoms. Beta blockers, which are typically used to treat heart conditions, can also be used to reduce physical symptoms of anxiety, such as a rapid heartbeat, shaking, and sweating. They work by blocking the effects of the hormone adrenaline. It's important to note that medication should always be prescribed and supervised by a qualified medical professional, as they can have side effects and may interact with other medications. How does psychotherapy treat anxiety disorders? Psychotherapy, also known as talk therapy, can help individuals with anxiety disorders by addressing the underlying thoughts, emotions, and behaviors that contribute to their symptoms. Several different types of psychotherapy are effective in treating anxiety disorders, including cognitive behavioral therapy, CBT, is a type of therapy that focuses on identifying and changing negative patterns of thinking and behavior that contribute to anxiety. CBT helps individuals learn to recognize and challenge negative thoughts, and to develop coping strategies for dealing with anxiety-provoking situations. Exposure therapy is a form of CBT that involves gradually exposing individuals to the things they fear in a controlled and safe environment. The goal of exposure therapy is to help individuals desensitize themselves to their fears and to learn that they can handle anxiety-provoking situations. Acceptance and commitment therapy, ACT, is a form of psychotherapy that helps individuals learn to accept and manage their anxiety symptoms, rather than trying to eliminate them. ACT helps individuals identify their values and goals and encourages them to take action towards those goals despite experiencing anxiety symptoms. Mindfulness-based therapy is a form of therapy that focuses on teaching individuals to be more aware of the present moment and to observe their thoughts and feelings without judgment. Mindfulness-based therapy can help individuals with anxiety disorders learn to accept and manage their symptoms, rather than trying to avoid or eliminate them. It's important to note that the choice of therapy should be tailored to the individual and their specific needs, and that some people may require a combination of different therapies. What happens if I don't get treatment for my child with an anxiety disorder? If a child with an anxiety disorder does not receive treatment, their symptoms may persist or worsen over time, causing them to experience significant distress and impairment in their daily functioning. They may have difficulty in school, with friends and family, and in social situations. They may also develop additional mental health conditions, such as depression. Anxiety disorders in children, if left untreated, can also cause physical symptoms like headaches and stomach aches, fatigue, and sleep disturbances. These symptoms can impact the child's overall health and well-being, and can also lead to decreased academic performance, school absenteeism, and difficulty making and keeping friends. Additionally, untreated anxiety disorders can lead to chronic conditions, making them more difficult to treat. Early treatment is crucial to prevent the anxiety disorder from becoming more severe and harder to treat over time. It's important to seek professional help if you suspect your child has an anxiety disorder so that they can receive a proper diagnosis and appropriate treatment. A qualified mental health professional can help your child learn to manage their symptoms, improve their daily functioning, and reduce the long-term impact of the disorder. Can anxiety disorders be prevented? Anxiety disorders cannot be completely prevented, but some steps can be taken to reduce the risk of developing one. These include managing stress through regular exercise, relaxation techniques, and maintaining a healthy lifestyle. Getting enough sleep. Avoiding alcohol and recreational drugs. Seeking professional help for emotional or psychological problems. Practicing good self-care and self-compassion. Building a supportive network of friends and family. Additionally, early detection and intervention are important for managing and treating anxiety disorders. It's also important to note that some people may be at a higher risk of developing an anxiety disorder due to genetics or other factors. When should I go to the emergency room for an anxiety disorder? It's important to seek immediate medical attention if you or someone you know is experiencing severe symptoms of an anxiety disorder. These symptoms include difficulty breathing or chest pain, rapid heartbeat or palpitations, dizziness or fainting, severe and overwhelming fear or panic, thoughts of suicide or self-harm, physical symptoms such as chest pain, which may indicate a panic attack. If you or someone you know is experiencing any of these symptoms, it is important to seek care in the emergency room or call for emergency medical services. Additionally, if you or a loved one have a history of severe panic attacks or have been diagnosed with an anxiety disorder and have been experiencing worsening symptoms, it may be appropriate to seek emergency care as well. It is important to note that if your symptoms are not severe and you are in general good health, it's better to contact your primary care physician or a mental health professional for assessment and treatment.